Hello, in this video I will talk about the dangers that await a patient when they are being treated for restless leg syndrome with Miropex, or the international name of the drug, Pramipexole. And the idea to make this video came to me after reading a comment on my previous video which I recorded about restless leg syndrome in general. In the description of this video you can find a link to the previous video, and I will read out this comment that was written under that video. I've had restless leg syndrome since I was 11 years old. Now I am 60 and I've been on Miropex for more than 10 years. I started with half a tablet, but unfortunately the patient did not specify the dosage here because there's a dose of 0.25 thousandths of a milligram and 1 milligram. You'll get the point regardless. Now the dose has been increased 4 times, 2 tablets per day. The suffering is indescribable with an opposite effect. I roll on the floor, tie myself in knots, run on the treadmill at night, and pour ice cold and hot water on my limbs. It's not just my legs that twist, but also my arms and sometimes my whole body. I don't even take the city bus. I walk everywhere. There's no question of flying car trips or going to the movies or theater. I read only while moving from room to room, shuffling along. There's no rest at all. Life is unbearable on levodopa. But that's another drug, a class of drugs I may also discuss. I don't dare to switch. That would be the last resort. After that, nothing will help. All the recommendations about walks, massages, compresses, and other funny advice haven't helped for 50 years. I have a very severe advanced form. I'm barely holding on. That's a bit of a rhetorical question. Do you see how terrible the situation is in general with the use of Miropex? And to prevent the possibility of such situations, that's why I recorded this video. And maybe it will help you to some extent understand why this happens. And if you watch until the end, you will understand what alternatives are possible to prevent this situation from developing. Or maybe, in principle, to start treatment not with Miropex, but with other medications that minimize the risk of developing such serious complications. My name is Roman Buzunov. I am a sleep specialist, professor, doctor of medical sciences, and honored doctor of the Russian Federation. So let's maybe start with a few words about restless leg syndrome itself. This is a neurological disorder characterized by extremely unpleasant but difficult to describe sensations, primarily in the legs, in the lower limbs. These sensations occur in the second half of the day and the first half of the night, and mainly when at rest. Especially when a person goes to bed and in fact is at rest and trying to fall asleep. These extremely unpleasant sensations arise, forcing you to constantly move your legs. Why does the patient say that she is constantly walking or somehow moving? And why actually do somnologists deal with this? This leads to severe insomnia, where a person is physically unable to fall asleep. There's also another aspect to consider. At night, a person develops what's called periodic limb movement syndrome during sleep, when the legs move periodically, stimulating the brain, and as a result, the person also wakes up and feels like they have insomnia. I won't elaborate further. As mentioned in the previous video, you can find it by following the link. In the description for this video, you can find more information about restless legs syndrome. So, regarding Miropex, or rather, let's put it this way. Restless leg syndrome is not a problem with the legs themselves. It's a problem with dopamine metabolism disorders, or so-called dopamine receptors. The dopamine system of the brain are affected, and a disruption of these dopamine structures in the brain leads to the development of this specific motor disorder. Doctors often don't fully grasp this and only treat these patients in a specific manner. They try all sorts of massages, sometimes even injections into the joints, check nerve conduction in the legs, use all kinds of baths, magnets, and so on. But as a rule, none of this helps. Because, once again, this is not a problem with the legs, it's a problem with dopamine metabolism in the brain. And to stimulate dopamine receptors, Miropex, Pramipexole, is used. In fact, this is a super effective medication. When you first prescribe it, especially if you use a fairly decent dose, although I will say later that you actually shouldn't do that, the effect is just fantastic. In fact, the patient is suffering. This is a woman. She is actually already suffering while on Miropex, yes. But without Miropex, when you prescribe the medication, everything goes away on the very first day, the very first night. The person sleeps normally through the night without any unpleasant sensations. The sensations do not appear by evening either. That is, there's even a term for this now, honeymoon period. And it would seem, yes, this is excellent treatment. And I'll say that when I first started using Miropex for restless leg syndrome about 20 years ago, those were exactly the recommendations at the time. That let's immediately prescribe fairly decent doses, 0.5 milligrams or even a whole milligram right away. Then once again, I want to emphasize that these are doses that should not be prescribed from the very beginning. So yes, we were getting a great effect. But it turned out that literally after a few years, sometimes even months, a person develops the so-called augmentation syndrome or slipping syndrome. Let's say we use Miropex and the person develops symptoms at 9 in the evening, so we prescribe it at 8 in the evening. After some time, the symptoms start appearing at 7 in the evening. We prescribe Miropex at 6 post-meridium and symptoms start appearing at 5 post-meridium. That is, they keep shifting earlier and earlier all the time. This woman, as you noticed, she already said that she has these problems around the clock, so to speak. They occur whenever she doesn't take Miropex. So it turns out that we have to prescribe Miropex earlier, but if we prescribe it right in the middle of the day, by evening it will have already worn off and we'll need to prescribe the next dose. So does that mean we already need to prescribe 2 doses of Miropex? And if later, right in the morning, the person wakes up and already has symptoms, then basically Miropex needs to be prescribed 3 times a day. And the paradox is that the higher the dose we use, the worse the situation gets over time. Moreover, the symptoms start to affect not only the legs, but also the arms, and all the limbs can suffer, and even the whole body can be affected, just as this patient describes as well. And such a complication can occur again after several years or even months, and it happens in about 30, sometimes 40% of patients. Moreover, as it was later proven, the higher the dose of the medication we use from the very beginning, the higher the likelihood of early development of this augmentation syndrome. Thus, the first recommendation, well, actually, this isn't a recommendation for you, it's a recommendation for treating physicians. And in general, I must warn you that any prescription of medication, especially if we are prescribing it continuously as maintenance therapy, should of course be done by a physician. Because as you can see, there are contraindications and problems with the use of the medication. So it is preferable to prescribe the minimum effective dose. And the medication is available in a dosage of 0.25 thousandths of a milligram, or mg. 0.00025 milligrams is 4 times less than a milligram. And the dosage prescribed is half of a small tablet of 25 thousandths of a milligram. That's only 0.125 thousandths of a milligram. Moreover, when, for example, this same Miropex is used in the treatment of Parkinsonism, the dosages there are almost up to 3 milligrams. And if 0.18 is actually 1.8 tenths of a tablet, that's 1.24 hundredths of the full dose of Miropex, which is used, for example, in the treatment of Parkinsonism. And the medication itself is very effective. Already such a dosage can actually produce quite a significant positive effect. Yes, it may not eliminate all symptoms, but it will significantly relieve them. But here it is extremely important to explain this to the patient, and the patient himself must understand that it is not necessary to achieve complete elimination of symptoms right away. It is better to choose the minimum dosage that will eliminate most of the symptoms, even if some of them remain, as long as they are tolerable. Subjectively, for patients, it is better to stay on this minimal dosage, because the lower the initial dose we use, the lower the likelihood of developing augmentation syndrome. It may develop only after many years, or it may not develop at all. And if we immediately prescribe a high dose, then there is a very high likelihood of first experiencing this so-called honeymoon period, and then all the symptoms that this patient, whether male or female, I can't say for sure right now, experienced, I will try to get in touch and maybe help the person. And now it's interesting that in modern clinical guidelines for the treatment of restless legs syndrome, it is indicated that Miropex is actually not considered a first-line treatment for patients with mild to moderate restless legs syndrome. Why? Exactly because it should be used as a reserve medication only in severe cases, when other options no longer work. And maybe let me remind you, the first thing you need to do, especially if, once again, I'm saying it might not be a very severe restless leg syndrome, is to eliminate all caffeine, tea, coffee, chocolate, because they specifically worsen restless leg syndrome. Sometimes just 2 or 3 cups of tea or coffee are enough to significantly worsen complaints of unpleasant sensations in the legs. And what is also extremely important is to get your serum iron and serum ferritin levels tested. It often happens that iron levels are still normal, but ferritin is already low, and ferritin shows the iron reserves in the body. So even a hidden iron deficiency can worsen restless leg syndrome. The thing is, iron is involved in the synthesis of dopamine in the brain. If there is simply not enough iron getting to the brain, well, if we don't consume enough of it, the problem is that not enough dopamine is synthesized, and there's a direct link to the worsening of restless leg syndrome. Thus, and moreover, there are also studies that say that, in principle, iron transport can be impaired. And here too there is an interesting feature. Guidelines suggest ferritin level should be around 30 or 150, but if it's 22,000, for example, that's significantly higher than the recommended range. In modern recommendations, it is said that ferritin should not be 20, not 30, but above 50, ideally 70 or even 75. Of course, again, you should discuss this with your doctor. But clinical guidelines say that ferritin should be significantly higher than the minimum acceptable normal values. If you've already eliminated caffeine, normalized your iron levels, or your iron is normal, then there is a first-line treatment, and now it's the so-called gabapentin. It's actually not a dopamine receptor stimulant. It has a slightly different mechanism of action. It's actually an anti-epileptic drug, but it can also specifically suppress these unpleasant sensations. And it's used for both mild and moderate severity. First of all, gabapentin is used. If that's not enough, after we've selected the right dose, because the dose also needs to be titrated there. 300 to 900 milligrams according to a specific regimen, again coordinated with your attending physician. But if gabapentin no longer helps, then you should consider using Miropex. But once again, I want to emphasize that you should consider the minimal dosage that might help improve the situation, but it will not completely resolve it. If such a severe dependence on Miropex has already developed, there is definitely no point in continuing to increase the dosage. Because, in fact, we might get a very short-term effect, but then this augmentation syndrome will only get worse and worse. And here, sometimes, well, again, you need to check iron levels, as I mentioned, and maybe even magnesium. It's worth checking that as well. Sometimes a lack of magnesium can worsen restless leg syndrome, and in some cases it can even lead to the prescription of narcotic medications. Of course, these are strictly controlled substances. They are narcotics. And here, in fact, a medical board is needed, a group of doctors who gather and decide what to do in this particular severe situation when the first-line treatment like gabapentin is no longer effective, and the second-line treatment like Miropex or some other dopamine receptor stimulants also don't work. So in this way, the decision is made collegially that it's necessary to take oral medications, that is, medications with narcotics, but only under strict medical supervision. I want to emphasize that in extremely severe situations, it's sometimes impossible to manage without this. This is especially true when such patients need to undergo surgery, God forbid. Imagine a woman, you saw her, she says she can't even be at rest at all. And let's say they're operating on the knee joint and the person simply can't walk. Yes, even if it's some kind of abdominal surgery and the person needs to stay in bed for several days, patients describe that they feel like they're being tortured, up to the point where they start to unconsciously slide off the bed, barely able to move. They are almost tied to the bed there. Well, just thinking that the person has started to have psychosis, but this is actually a real psychosis. Because of these severe symptoms of restless leg syndrome, they start injecting them with all sorts of tranquilizers and sometimes even antipsychotics. But, by the way, tranquilizers can actually help with this, while antipsychotics paradoxically can make the situation worse. But this could be a separate topic for discussion, how restless leg syndrome is treated incorrectly. By the way, worsening of the situation, maybe I'll look into it further. So, here's how she was treated. But she says that she went to different doctors sometimes. What do doctors do? They say you have problems with some unclear complaints. Let's try giving you antidepressants or antipsychotics, or maybe you have something psychological, and antidepressants and antipsychotics too. They interfere with the metabolic processes of the brain and in particular negatively affect this dopamine metabolism and can worsen restless legs syndrome. And the paradox is that the higher the dose of antidepressants or antipsychotics a person is given, the worse they feel. This is also a sad situation when doctors don't quite understand what restless legs syndrome actually is. And in this situation, of course, such medication should be discontinued because otherwise we will only make the problems with restless legs syndrome worse. In general, once again, in conclusion, I want to emphasize that yes, Miropex is a very effective medication, but a coin always has two sides. On one hand, we can get a super effect, but on the other hand, there is always this Damocles' sword. The development of the augmentation phenomenon, which will lead to the fact that we will actually lose all the benefits we initially had when a person's symptoms become even more pronounced while already taking the medication. Well, I hope I have to some extent warned you against using Mirapex too actively. I think this could be useful, and patients will watch it and doctors will watch it too. And yes, of course, we should try to help the patient, but there is always that good saying, you shouldn't shoot sparrows with a cannon. You shouldn't immediately prescribe Miropex, especially in high doses, because this can lead to even bigger problems than at the very beginning. I hope this information will help you cope with restless legs syndrome and take appropriate actions to minimize the risk of developing augmentation syndrome while using Miropex.